knock. Hi, Kylie. My name is Sydney. I'm going to be your student nurse today. I'm going to be performing a head-to-toe assessment. What this will require is me just systematically going through your body systems from your head to your toe to just see if there's any abnormalities, and if there are, that we can get them documented, okay? What this will require of you is to just let me know if you feel uncomfortable or any sort of discomfort during this procedure, or ask me any questions that you have. You can stop me in the middle of it. And I may expose some parts of your body, but we'll keep your privacy as much as possible, okay?
Okay.
Do you have any questions for me now?
No.
Okay, are you comfortable?
Yes.
All right, I'm gonna go ahead and perform hand hygiene and collect my equipment and pull the curtain for privacy. Can I go ahead and see your wristband first? All right, can you tell me your name and date of birth?
Kylie Huggins, June 21st, 2000.
Okay, so I have confirmed that with her wristband. She is who she says she is. Everything that I will be doing will be bilaterally where it is required, as well as any palpation or auscultation would be underneath the clothing, but for this assessment it will be on top of her clothes. All right, so I'm gonna go ahead and go do that, okay?
Okay.
Pull this in. I'm going to perform hand hygiene. Kylie, do you have any allergies?
No.
Okay, awesome. To any food, latex, drugs?
No.
All right, awesome. I'm gonna go ahead and put on my gloves. All right, I looked at Kylie's vital signs. Her blood pressure was 120/80. Her temperature was 98.6. Her heart rate was 65. Her respirations were 16, and her oxygen level was 99% on room air. Okay, all right, so Kylie, can you tell me where you are?
UACCB.
Can you tell me why you're here?
Head-to-toe assessment.
And do you know what day it is?
Monday.
Okay, Kylie is alert and oriented ×4 to place, time, and situation. All right, Kylie's facial expression, she is smiling and relaxed, and she appears to be pleasant and comfortable, so her mood and affect do match. Kylie is dressed appropriately for the season, for the occasion. She is neat and clean. Her posture, she is sitting upright with her hands folded across her body, and she is of normal body weight, and she is proportionate. All right, I'm gonna go ahead and move into skin. I'm gonna go ahead and inspect her skin. It is smooth, it is tan, it is intact. Upon palpation, it is warm, it is symmetrical, and it is dry, it is dry. Okay, so I'm gonna go ahead and assess your skin turgor. Her skin turgor is good. There is no tinting or edema. On a regular head-to-toe assessment, not on Kylie, but on a regular head-to-toe assessment, I would assess the pressure areas, which would be the sacrum, any place with a bony prominence, for any arrhythmia, any blanching, or any wounds. Okay, Kylie's head is normal cephalic. There are no lesions or nodules or involuntary movements. I'm gonna go ahead and take a look at your eyes, Kylie. There is no redness or tearing. There is no ptosis or discharge. Her sclera is white and her conjunctiva is clear. I'm gonna go ahead and get my pen light, Kylie. I just need you to look at my forehead, and I'm gonna introduce light into both of your eyes, okay?
Okay.
All right, Kylie's pupils were 3 millimeters on both sides at rest. When light was introduced, they constricted to 2 millimeters. All right, can you go ahead and just look at this pen? I'm gonna be testing your accommodation. All right, Kylie's accommodation is intact. So her pupils are equally round and reactive to light with accommodation intact. All right, Kylie, I'm gonna take a look in your nose, okay? Her nares are patent, her septum is midline, her mucosa is red, and there is no lesions or discharge. Okay, Kylie, can you open your mouth for me? All right, Kylie's lips are pink and dry, her teeth are white and straight. Her uvula and tongue are both midline, and her tongue does not have any tremors. Her tonsils are graded at a 2+, and her mucosa and gingiva are both pink and moist. All right, Kylie's chest is symmetrical anteriorly and posteriorly. Her breath sounds are unlabored, normal, and smooth and even. And her AP diameter is less than her transverse diameter. All right, I'm gonna go ahead and listen to your lungs, Kylie, okay?
Okay.
The 5 spots in the front, like I said, this would be performed underneath her clothing. On each side in the front, 5 spots. 1, 2, 3, 4, 5. All right, so Callie's gonna lean up and I'm gonna go around the bed to do the 9 spots on each side in the back. 1, 2, 3, 4, 5, 6, 7, 8, 9. All right, breath sounds were clear in all lobes. All right, I'm gonna go ahead and take a listen to your heart now, Callie, okay? Aortic, pulmonic, tricuspid, and mitral. S1 and S2 sounds are present, and a regular rate and rhythm was heard. All right, I'm assessing Callie's upper and lower extremities for any varicosities or edema, and I am not finding any in either bilaterally. Callie, can I take a look at your nails? All right, her nails are smooth and pink. There is no clubbing or deformities. I'm gonna test her capillary refill. The return is less than 3 seconds. I would do that on a toe as well. And the return is less than 3 seconds. I'm gonna go ahead and palpate her arteries. Carotid, brachial, radial, femoral, and dorsalis pedis. Those are all rated at a 2+. Okay, Kylie, I think that is it for the heart. So I'm gonna go ahead and move into the abdomen. When was your last bowel movement?
Today.
Was that normal for you?
Yes.
Okay, and when was the last time that you urinated?
Today.
Okay, and was that also normal for you?
Yes.
All right, upon inspection of her abdomen, it is, there's no discoloration, there's no scars, there's no stretch marks, there is no masses, bulging, and then her contour of her abdomen is flat and muscled. All right, I'm gonna take a listen to your stomach, okay?
Okay.
Bowel sounds are active in all 4 quadrants. I'm gonna palpate. You let me know if you feel any discomfort, okay?
Okay.
All right, so no discomfort was noted upon palpation, nor did I palpate any sort of masses or bulging. All right, Kelly, I'm gonna move into musculoskeletal. I'm gonna go ahead and assess your strength, okay? Can you squeeze my fingers? Can you pull against me and push against me? Strength is adequate in the upper extremities. I'm gonna go ahead and test your range of motion now. What I'm gonna have you do is abduct and adduct your arm, and I'm gonna put my hand on your shoulder, okay?
Okay.
All right, abduct, adduct, awesome. So now I'm gonna have you flex and extend your arm, okay? I'm gonna put my hand on your elbow, okay? Flex, extend. Okay, there was no crepitus noted in the shoulder or the elbow. Okay, Callie, so with your leg, I'm gonna have you abduct and adduct with my hand on your hip, okay?
Okay.
Abduct and adduct, okay? And then with your, I'm gonna put my hand on your knee and you're gonna flex and extend, okay? Flex, extend. All right, no crepitus noted in the hip or the knee. Okay, I'm gonna test the strength in your legs, okay?
Okay.
Can you push up against my hands? All right, thank you. Can you go ahead and pull your feet against my hands and push? All right, perfect. So strength was adequate in the lower extremities as well. All right, Kylie has the, no. Kylie's gait as she walked into the room, I noticed that it was normal, it was balanced, and it was even. Now I'm gonna move into neurological. Kylie has the ability to follow commands properly. I'm gonna go ahead and assess her sensation. I have my pin here. This part of the pin is gonna be considered dull, while the actual pin itself is gonna be sharp. It'll feel like this.
Okay.
Okay, I'm gonna do this on your arm and your leg. I'm gonna have you close your eyes and tell me which one you feel, okay?
Sharp. Dull.
All right, I'm gonna move into your leg.
Sharp. Dull.
All right, so her sensation is intact in both upper and lower extremities. All right, so with Kylie, I'm not going to do this, but with any other patient, I would have Kylie stand in these 4 positions, hands above the head, hands on hips, hands together, and leaning forward so that I can inspect for any dimpling, indurations, or bulging. And then I would palpate her breast tissue in the vertical strip pattern, paying close attention to the axillary tail of Spence. All right, so that is the conclusion to my assessment. Kylie, do you have any questions for me?
No.
All right, here is your call light. I can get it over here. And if you need anything, just call it, okay?
Okay.
All right, thank you.